This is Evie.
This is Alissa.
This is Chelsea.
And this is Caroline.
Welcome to Med Surg Moments, the AMSN podcast.
This podcast is an engaging look at the lives of and surrounding medical surgical nurses.
So here we are live at the 2021 AMSN, the Virtual Annual Convention. How are you all doing? What is going on?
Well, first of all, it's just so exciting to be all together. It's been a while since the four of us have got together, albeit virtually, but that's wonderful. And welcome to our listeners at convention. Sorry, we're not doing this face-to-face, but so glad that you could join us.
So Chelsea, what's new with you?
Oh, just being a student and a nurse. So I think I mentioned to our listeners before that I am pursuing my acute care nurse practitioner degree at Duke University. So I've been working on that. I also started travel nursing. I don't know if we have any travel nurses out there. If so, we would love to hear from you. But I started with a company called Nomad. They're relatively new. Still doing the investing thing. So looking at NFTs, stuff like that. Oh, one thing I did recently do, I traveled to New Mexico to visit my friend who's a travel nurse out there in Albuquerque. So anyone from New Mexico or Albuquerque or Santa Fe, shout out to you guys. It's a beautiful area. And we took a ride up a tramway up the Sandia Mountains, and it was beautiful. It's a wonderful trip. I can't wait to get back out there.
Wow. Sounds fun. You said you were in New Mexico, so I think that's Alyssa's neck of the woods, right?
Sure is. Yep. Just a little north up in Utah.
That's right. What's been going on with you?
Things have been just crazy. We have a loved one, a family member in the ICU right now with COVID. This is the first time that I've had COVID personally impact me this close to home. And unfortunately, it was somebody who opted out of the vaccine. And we are definitely seeing the differences between somebody who's been vaccinated and somebody who has not have COVID. And that's been really hard watching our family member struggle. This happened Monday that he went into the ICU. So it's been soaking up all my time and attention lately.
Wow. Of course, we send our love and our prayers. We wish your family member well. All right, Caroline, I know you have something to tell us.
I do. Well, don't I always? I was actually very fortunate to finally cross the pond and go and see my family in almost 2 years. So it was a different journey, testing 3 days before, testing on day 2 when I got there, and then testing 3 days before I came back. So I'm well tested. So it was interesting to see what life is really like with the pandemic in England. And a lot of things have been relaxed now. Some people are still being cautious and wearing masks, but a lot of stores can only suggest that masks are worn. They cannot mandate anything. We all talk the same language here, but everyone addresses the pandemic. They call it the COVID. It's the COVID. Before the COVID this, before the COVID that. And then I have my cousin's mother-in-law doesn't talk about lockdown. She talks about breakdown, all about the breakdown. When we had the COVID and the breakdown. So it's cute. But with that wording right there, just really helps us understand that a lot of people have been really dealing with a breakdown psychologically with this pandemic. So that was my big news, really. It was nice to see everyone and talk about the COVID.
Well, glad you're back. So glad you're back, Caroline. Glad you all are doing well. On the East Coast of Baltimore, East Coast of the USA. It's just been busy. It's been busy here. I've been not only working, of course, but I'm still active in my community, trying to make a difference where I can, particularly in the area of our education, public school education here, and some of the, crime matters. Been busy with that and just trying to educate the public and our communities over here.
That's awesome, Evie. I still, again, think it's amazing that you're active in your community. And I would encourage everyone to look at you as an example of how you can make a difference where you live, which I think is great as we transition to our topic, which is the unexpected pathways to med surg nursing wisdom, which I feel like we all gain wisdom as we are going through our careers. I would encourage our audience to leave their questions or comments in the question box for us, and we will do our best to address them as we go along. Our topic, our med surg wisdom that we've gained over the years. Who would like to kick us off with some of that wisdom that you've gained?
I guess I can kick us off. I've been a nurse for a little bit over 5 years, graduated from UVA nursing program in 2016, stayed there for a bit, now a traveler nurse on a neck and spine unit. I think I really want to go back on the theme that med surg nursing is the foundation of all nursing. When people think about what their specialty should be when they graduate, they just have to remember that med surg nursing is a specialty. I think that having those 5 years of experience on a med surg unit, it's invaluable because you literally see everything. And when those patients present to you, those complicated patients who are like critically ill sometimes, step down patients, because at the first hospital I worked at, which was UVA Medical Center, we don't have a step down med surg floor. Like you're either med surg or you're ICU. So those critical step down patients would be on our med surg floor. But it made me learn and grow in so many ways. And so now that when I see the similar situations or similar clinical presentation, I say, oh, I've seen this before. And it really makes my brain happy to know that I've had that experience. It's nice to be able to be a team player that way, to have that experience and say, oh, I know what to do, or I know what we should do. So that's where I would like to begin.
Who knew that as tough as this pandemic has been, what wisdom we would have gotten out of this. As a med surg nurse, our knowledge base has to be so broad, but I think this is a perfect way of bringing everyone's expertise together. Perhaps a med surg nurse who had an interest in infection prevention, who worked exclusively on a floor where there was a lot of infection, can now use those expertise to bring forward in educating other med surg nurses about COVID, about the precautions that we've all had to take. And who'd have known it would have taken a pandemic to gain that wisdom along the way. The other thing, of course, for those of you who were able to join our very first session this morning, Terry Foster was talking about humor in nursing. And of course, even in our darkest moments, it's that borderline inappropriateness, but in our darkest moments, sometimes we have to pull on humor to consolidate the wisdom that we've learned in every situation, however grave that situation may be.
That's great, Caroline, because I was thinking, what wisdom have I gained and what wisdom have I brought to my profession? Nursing is really, I guess I would say, a third career for me. And one of the things I used to hear from nurses when I was first a nurse was that nursing is a part of life. Nursing is a part of life. I like to switch that around and say life is a part of nursing. And by that, I mean that our patients, our coworkers, the people we meet, they are part of life. They're experiencing life. They're going through life. They just happen to meet us in a hospital, in a clinic, wherever we may meet them. But in doing so, one of the things that comes to my mind is that in meeting people and developing those relationships, not everything can get a Band-Aid. There's not a prescription sometimes to fix every problem. So sometimes our patients, our staff, our coworkers, they just need us. They just need to hear and know that we are present. That's the prescription, at least for that moment. So it's not always necessarily that because we have a patient, there's a medical diagnosis that we are there to tend to. Sometimes we're just there to tend to the human part, heart to heart.
Very true. Good point, Evie. I agree. Nursing is definitely a profession that deals with matters of the heart. Sometimes patients are there for super simple things, but you don't know what's happening. Some of our patients don't have secure housing. Some of our patients don't have clean water to drink. Some of our patients don't have clean air to breathe. Some of our patients' home isn't a safe place. So thank you for bringing that up, because I definitely have all of that in the back of my mind when I'm interacting with my patients.
Which is a really great topic that was discussed earlier in one of the lectures today when they were talking about the health disparities and what med-surg nurses can do. That came out of that report, that 2020-2030 nursing report. So I would encourage you to go back and look at that lecture if you haven't seen it, because it was really great. Some of the things that are coming from our audience, just because the doctor ordered it, doesn't mean that the doctor really understood. So don't ever do something right just because it's been ordered. Nurses really are that critical thinking piece between the doctor and the patient. And so I absolutely agree with this comment. So you really do need to be that critical thinking piece, that final filter of, is what's being ordered the correct thing for the patient? And then we did get a question about so many nurses leaving med surg for specialty areas and how can we retain them? I think a part of that is need to recognize med-surg nurses for the specialty that they are. If they don't feel like what they're doing is special, then they're going to look for something that gives them that specialty recognition.
Right. For years, just thought med-surg nursing was the starter for something bigger and better. But now, with everything that a med-surg nurse has to do, we really have to be mindful to manage each other up and understand and help our coworkers understand that just look at the knowledge base that you have. And when everyone focuses on their own knowledge base and brings that together, you have such a wealth of skill and expertise. And if that's not a reason to stay in med-surg, I don't know what is. A lot of people say, oh, I'm bored. There's nothing new. There's nothing exciting. Where have you been? Just look at the patients that you took care of yesterday. How many different disease processes? What was your knowledge base? And if you share that with each other, we are a powerhouse, an absolute powerhouse.
We need to incentivize nurses to stay. We need to be paying our nurses more, have a bonus every year for certification. And then I think the second thing that we need to do is we have to renew the passion for nursing. This past year has just really brought basically an onslaught of doubts and fears and frustrations, et cetera. I've really been thinking about that lately is how do we renew the passion for nursing? It's not just enough to say, oh, like we need to make people aware of the nursing profession, but how can we create more nurses who are passionate about their jobs and who are happy doing what they do? So I think that definitely has a huge role to play in retaining med-surg nurses.
Yeah, Chelsea, you shared with our audience that you've been a nurse for 5 years. Well, I'm not going to say the exact amount of years I've been a nurse, but it's a little bit longer. And so if that does something, it makes you look back and reflect and think about the wisdom that you gained. And I think at the root of the question to ask is, would I still do this? Would I still choose this? And am I crazy to say yes? This is the only profession I ever wanted to get into. And it's still the profession that motivates me to get up and be the best person that I can be every day, even though I'm not doing direct bedside care anymore. And I think that's one of the pieces of wisdom that nurses gather along the way. And eventually you find the place that you're meant to be. And along that journey, you encounter so many different patients and skill sets and expertise that if that's not a pathway to wisdom, I don't know what is. Looking back retrospectively, I wouldn't really change a thing. And I think a lot of our audience out there hopefully will be feeling the same way. Coming together at convention is always so motivating, exciting, and empowering to be in the same room with like-minded people.
You had a question about the toughest lesson that we've learned. And one of the toughest lessons that I learned, and I guess I would say I'm still learning, is learning Evie. And learning what Evie needs, and also realizing that in my role at work, I'm oftentimes seen as a leader, even if I don't think I am or don't want to be. But at the same time, once I'm aware of that, then I have to shift back and say, okay, not only am I learning Evie, but what message is Evie sending? Because obviously some people are watching me more than I would like to be watched. But so I have to be mindful of that. And at least for me, that's tough because it seems like I'm always shifting in my mind, like, okay, well, almost like you're walking on your own eggshells. That's a tough rope, I guess, to walk.
On that same line, when I think about the toughest lesson that I learned in my career, which has led to wisdom, I would say it's accountability. I know that sounds strange, right? It's not like I entered the workforce as a giant liar or something, but it's not only my own accountability of cause and effect, and not just with my patients, but it's my coworkers and my charge nurse, and doing what I say I'm going to do and say what I'm doing and following through. Because as you move into those unofficial leadership roles, when people really do start looking at you as a leader on the unit against your will, of course, right? No, you don't want that. But it's recognizing that I have to hold myself accountable, because if people are looking at me as the example, then my accountability has to start with myself. And then when I'm being moved into leadership roles like charge nursing or being a preceptor or something, I have to learn how to hold other people accountable. And so I think that was probably one of the hardest lessons I ever learned, but it's one that I'm really grateful I learned early before I got into nursing, thankfully, so that it wasn't as hard. If I had to learn the lesson of accountability in the nursing workforce environment, I think mistakes could have been made. Luckily, I got to learn how to be accountable and learn who I was. And you, like Evie said, and recognize that stuff earlier, because that's hard. That's part of growing up and becoming an adult. And too many times you can see nurses that come straight from to go high school and then college and nursing, and they're in the nursing industry when they haven't really lived any life. And I think it's amazing that people do that. I think that they're amazing nurses and they're set up for a really great career, but they still have some experience to gain in how to interact with those patients, life experience to gain in how to have those interactions and work with those patients so those patients have that trust.
Yeah, certainly. One of our audience here is asking how we define the medical surgical nursing specialty. And I think learning to be accountable is certainly one area that needs defining, but also it's an area where there's really never a dull moment. And the other thing that I think defines med-surg nursing is the diversity in the patient population, which helps us decide where we want to work. As people prep for Med-Surg certification, and we talk about the major body systems, and I teach these classes, and the look on people's faces when I talk about the GI system, the endocrine system, but I don't work on that kind of floor. No, but someone else does and can share that expertise, or there's an opportunity there to help you define your role and find your niche. So it's very hard to put into a sentence or two as to the definition, but I think that's probably one of the wonderful things about the med-surg specialty, that there is no hard and fast definition per se, because we're all trying to figure out just where we need to be.
I think one of the things that we've talked about many times on all of these podcasts, communicating with my colleagues, with myself, with my superiors. And I think that makes a difference, particularly to new nurses, when we have to train them and maybe they haven't done something correctly or they made a mistake. We have to walk that balance. We want to correct, but we don't want to crush their spirit. We don't want to leave them so worn and so mentally drained that they are not able to bounce back. They don't have that resilience and they don't have that passion to keep on in the profession. So that's a part of what I have learned as well, that delicate balance between letting the trainee know that we're here, we're going to help you, we're here to teach you, and you're here to learn. But at the same time, we're not here to just run things, ramshod you, and leave you hanging to dry. And that's not what we are about. And I would encourage, if any one of my colleagues, not just ones that I know, but across the country, if that's what you are experiencing, please reach out for help. Reach out to your manager or to some trusted mentor to say, you know what, I'm being precepted right now, but I need to have a little bit more balance. So we need to be able to do that. That communication piece, I think, is so important.
Most definitely. Yeah, most definitely.
And you're talking about constructive feedback, really. We need to make sure that we're giving our feedback in a way it can be received and learned from and not shamed. It's not shameful. Everyone makes mistakes. We learn from it and we move on. Got to remove that emotional attachment to the feedback, give the feedback, and help them learn and grow. Everybody makes mistakes. If we're making this new nurse feel like they're the only one in the history of the planet that's ever made this mistake, we are doing this wrong.
Exactly.
Statistically, they're going to make a mistake.
Absolutely.
Yeah.
Absolutely.
So definitely letting people know that's a part of the learning process.
Yeah, for sure.
So I think allowing people to make safe mistakes, you know, saying, hey, because as a preceptor, you look at everything anyways. Hey, did you look at this lab value, or what do you think we should do?
The roller clamp on the mini bag on the secondary, that's the one I always tell them. I'm like, you'll only make this mistake once, and we're only 30 minutes behind on the med. So let's just unroll it and go for it.
And as crushing as mistakes, there's a valuable lesson in wisdom right there. And someone is asking that exact question. And I think that the way for young nurses to gain wisdom is to realize, just like Chelsea said, you're going to make a mistake. That's the reality. But what are you going to learn from it? What are you going to take away from it? Where's the teachable moment? And whatever the outcome, and maybe it's not a good outcome, whatever the outcome is, you'll never forget it. Years and years and years ago, I made a drug error on a pediatric patient, and it has stayed with me all of these years, and I still feel sick when I think about it, about what the outcome could have been. The little boy was fine. He just slept a little bit longer, but it stayed with me. And any time down from then, the wisdom that I gained there was, okay, you messed up, you made a mistake. Don't ever do that again. And don't just double check it, triple check it, quadruple check it, because mistakes are a part of life, unfortunately. But as long as you can take something positive away from it, that's when I think the wisdom is imparted in our younger nurses, definitely.
Yeah.
So I haven't been in nursing as long as Caroline, but a little longer than Chelsea. I just fall right in the middle.
Me too.
Ultimately, the wisdom that we gain from the med surg nursing industry is how to take care of people and how to help people feel better, and recognizing when is this battle I need to pick versus when are we okay and I can comfort the patient on my own. And I think in the beginning, we're more reactive and we're more nervous and we don't want to make mistakes. And over time, we start getting more comfortable with our nursing intuition and we start having that experience-based practice that we're building because we've seen it enough and we know what to expect from our patient and recognize when our patients aren't doing what we expect and when we need to be concerned. So the experience that's gained from med surg nursing, I think, is invaluable. And when we were asked, how would we define it? I think my favorite definition, comes from Terry Hinckley, the CEO, where she says med surg nursing isn't where you practice, it's what you practice. It's taking care of the entire patient, So.
Absolutely. Time is almost done. Can you believe it? We have to start wrapping up. So we really, truly look forward to connecting with you all on our next episode of Med Surg Moments, the AMSN podcast. In the meantime, we want to continue to hear from you. Send your questions via our official Med Surg Moments email address, which is amsnpod@amsn.org. So once again, amsnpod@amsn.org.
We'd also like to remind you to become a member of AMSN or renew your membership at www.amsn.org. You receive lots of cool benefits and perks, such as discounted pricing on the annual convention and continuing education.
We encourage you to help us spread the word and subscribe to the Med Surg Moments podcast via your smartphone podcast app to receive notifications for future episodes. Please be sure to leave us a review and recommend Med Surg Moments wherever you get your podcasts to help us reach more listeners.
We also invite you to join the conversation by sharing your ideas and questions on AMSN's Facebook, Instagram, LinkedIn, and Twitter pages. And don't forget to add hashtag MedSurgMoments to your post. Simply enter AMSN in the search field on any of these social media platforms, and you will connect with us.
And finally, the contents within the Med Surg Moments podcast represent the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses.
Until next time, I'm Alissa.
I'm Caroline.
I'm Chelsea.
And I'm Evie. Always remember, Med Surg Moment is a moment in our lives, a moment in our med surg careers that makes a huge difference.